Hello, everybody. Thank you for watching this session on a palliative care escape room, too serious or a game changer. My name's Dylan Harris. I'm a consultant in palliative medicine. I work with both the NHS and a hospice organisation, and also a lecturer. So in this session, we're just going to think about, first of all, what is palliative care before we start to talk about an escape room in it. And why is that important for everyone? And why is it particularly important in healthcare education? And then think about, can aspects of palliative care be taught in an escape room? So what's the current literature situation? I'll show you a worked example and we'll see what both participants and facilitators felt about using that method. It's a live escape room to teach palliative care. And then we can come back to the question that we've started with. So palliative care escape room, too serious or a game changer? So this is part of the World Health Organization definition of what palliative care is. So it's talking about people who've got progressive life-limiting illness and improving and supporting their quality of life. That might be through physical issues that have arisen like pain or psychosocial and spiritual things as well. And it's very much a team approach to supporting those people to live as actively as possible until they die. So that's the World Health Organization definition. And this lady, who's Cicely Saunders, she founded the hospice movement in the UK, and a lot of what she set up has been replicated now throughout the world. And she summarized palliative care like this: so you matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die. So why is it important? So unfortunately, the world mortality rate is 100%. Everybody will die at some point, and that's not predicted to change anytime soon. So it's important for all of us to think about how we might die, and particular wishes and things that we may have at that point. And in terms of provision to support people who have a progressive life-limiting illness and approaching the end of life, with the changes projected in the population that you can see on the graph on the right, the need for palliative care will also rise exponentially within the next 20 to 30 years. So important for everybody to think about, and particularly important for healthcare education. We know that, unfortunately, historically, so palliative and end-of-life care is something that's perhaps been lacking in training for healthcare professionals. And it's also something that healthcare professionals can feel most unsupported or apprehensive about when they qualify and start looking after and caring for people. So really important. So currently, in most types of healthcare education, there might be a variety of different ways that palliative and end-of-life care is taught and people are trained in it. So there may be clinical attachments, for example, at a local hospice, lecture-style teaching, case-based learning, so reflecting around patients' online learning modules, role play or simulation, particularly for things like communication skills. What about an escape room, though, for palliative and end-of-life care? So is it appropriate? Is it possible to design something around palliative and end-of-life care? It's a very serious and sensitive topic, and is it feasible? And so on, many questions. So there's very actual little in the literature at the moment about escape rooms for palliative care, palliative and end-of-life care training and education. Obviously, there's ever-increasing literature base now around escape rooms per se, but for palliative care and end-of-life care, there is very little published to date. But we know there are lots of useful frameworks, guidelines, and general evidence base around using escape rooms and using escape rooms in healthcare education that we can use then to test and design whether we could apply the same in palliative and end-of-life care type setting. So that's what we did in this example. I'll just talk you through how this escape room works. It's based on the principles of things that are currently published in the literature. So we've got a very high-tech diagram of a room here. On the left-hand side, you can see a little lock. So the door's locked, and that is a combination padlock that needs 5 letters to unlock it. And then we've got some chairs where the participants can sit initially, and we've got some hazard tape line that's on the floor in the middle of the room. And the other side of the hazard tape line, you can see there are a number of different puzzles with small pictures there of each one, which I'll show you in more detail in a second. So our learners in the room, obviously they're locked in because it's an escape room, will be sat on those chairs with this sort of a briefing here. So this is the rules of play, if you like, in the room. So at any one time, one of them can go across that hazard line in the middle of the room and try and look at what those puzzles are on the other side. All the person that crosses the line needs to do is to describe what to the others in the room, what it is that's in front of them, what it's asking them to do and what their options are. So they don't need to solve any puzzles on their own. They can do that by talking through with their colleagues who are the other side of the line in the room, just describing what the puzzle is. Only one of them can go across that line at any one time, but they can interchange as much as they want. So they can swap around who is in trying to solve the puzzles back and forth between them, as long as one of them is the other side of the line. They can't move anything in the escape room, so they can't bring the puzzles closer to their other colleagues who are sat the other side of the line to show them. They just need to describe them where they are. They can have some other roles depending on what people are keen to do in the room. So as you can see in their instructions, it suggests one of them might want to be a timekeeper because they only have 20 minutes in the room to work out what all the puzzles are and to put the letters that they get from them into the lock. They might want one person to note down the letters as they collect them in the right order because they'll need to put them in the right order to unlock the lock and so on. So people can opt to do different things, and if everyone wants to have a go the other side of the hazard line, they can swap around who's there as well. So each of those puzzles, as we'll see in a minute on the next few slides, there are some learning outcomes or specific learning attached to the purpose of the puzzle. And all of them will need some sort of critical thinking and problem solving around palliative care and end-of-life care to solve the puzzle. They're working as a team, so they don't have to solve anything individually in this escape room. They can work as a team to work out what they think the best option are. And as with all escape rooms, there's psychological safety with the briefing at the beginning from this with the facilitator, and people can opt to have different roles in the escape room if they wish to. No one's individually having to solve anything. And at the end, they all sit back together with the facilitator who would have been observing from the next room to go back through the puzzles and to check everyone's happy with what the learning outcomes were. So there's a facilitated debriefing then after the 20 minutes, whether they've still locked in or they've escaped, just to go back through the learning from each of those puzzles there. So some of those pictures are a little bit bigger to give you an idea of the sort of puzzles in this sort of escape room. So the white piece of paper has got a little bit of description all about the same patient. All of the puzzles are around the same patient. And there's 3 different pain medicine bottles that you can see in the picture there. So based on the description of the information that they've got, one of those bottles is more appropriate to help with the pain than the others. And depending on which of those 3 bottles they pick, they'll end up with a different letter. There's a letter on the bottom of the bottle, and that's their first letter to try and put into the padlock. In this example here, they've got a drug formulary, so the British National Formulary, and they've got a UV pen. So again, they're looking for a particular medication based on the information that they're given. And if they find the medication in the drug formulary, they can use that UV pen and they'll find a hidden letter on that page, which will be a letter to put in the padlock. In this example, you can see a blue tray with several things in it. There's an oxygen mask, a fan, some different types of medication. And again, they've got some other information now about this patient. So they need to read that with their colleagues or describe that with their colleagues, and then pick things out of that tray that are most likely to help with the symptoms the person's got the most. And you can probably just make out, depending on what you pick out of the tray, you'll get different letters in your answer. This example, you've got some patient information leaflets. So the green leaflets are leaflets designed for patients to help them with their understanding and how they cope and manage with things relating to, in this escape room, it's a patient with lung cancer. For the information again that they've got, one of those leaflets is more appropriate than the other ones to use with this particular patient. So they need to look at all of the three leaflets there, and pick the one that they think is the most appropriate, that would help the most for this patient. And again, depending on which leaflet they pick, they'll get a different letter to put in their lock. And this puzzle here, so you can see some vomit in a vomit bowl, and there's three different, medicine charts to help with the problem that's occurred here. And they've got a little bit more information again now about this patient. So they're going to read that, pick which they think is the most appropriate of those medication charts from what's described as having happened. And each of those charts has got a different letter on it again to use in their padlock. So they'll end up with a number of letters, and they can put those letters then into that lock to see if it locks them out of the room. And as you saw in the briefing, that they've got a time limit on the room, and depending on who we're using this with, we might vary the time that they're allowed. So depending on this sort of experience and the type of learners that are in the room. So after they've escaped or not escaped, there's a facilitated debriefing then with a facilitator, and they've got their own facilitator guide to keep it consistent for some of the things that they do then in that debriefing with the learners. So for each of the puzzles, they've got a page that would look a little bit like this. That gives them the information that the learners would have had in the room. And they've also got some learning points or takeaway messages. So they'll prompt the learners first to ask them what they think the learning point or the takeaway messages were from that particular puzzle. And if they haven't quite got everything, they've got that then on their facilitator guide. So everyone leaves the room, if you like, at the end with the same learning to take away back to their clinical practice. So we piloted this first with faculty of tutors, and that was to test out how well the instructions read, the timing, how well the puzzles work, or any conflicting information in it, and to iron those things out. And so far, this escape room has been used with groups of mixtures of postgraduate nurses and doctors, so trying to work, they'd be working together in the escape room to solve those puzzles. And we've also used it with just GP trainees. So these are qualified doctors who are then training to be a GP, a general practitioner. So we've also used it with those as well. So we've collected some quantitative feedback and some qualitative feedback from those learners so far. So this is one example here. So here, the learners are scoring on a 5-point Likert scale between strongly agree and strongly disagree, around a number of statements around whether they felt the escape room facilitated team working, whether they felt it was actually useful to help their own knowledge and understanding, helped interacting and learning from others, and whether they'd recommend this use of an escape room as a way of teaching those aspects of palliative and end-of-life care. And you can see the scores have so far have all been very favourable towards using an escape room here. Some examples here are the sort of comments, the qualitative free text comments that people have put. So you can see the word fun, and given it's a very serious topic area, it's interesting that people have found it fun and appear to find it useful. And from faculty members, so facilitators then that have facilitated the escape room, this is probably a good summary of their feedback. So not a panacea, but definitely has a place in palliative care teaching. So it depends what exactly is being taught and how, and as with everything, we have when we're teaching anything, we have a whole range of things in our toolbox, different ways of teaching things that we can use. But generally, people have felt that an escape room can be used to teach aspects of palliative care from the facilitator point of view. So those pilots appear to have been successful so far with those small groups. So we've now got a number of other groups lined up over a number of months now with different facilitators to build on the feedback that we've had so far. So to summarise then, so palliative care is an approach for patients who have progressive life-limiting illness, focused around supporting their quality of life. It's an important subject area for everyone to think about. Everyone will die at some point, and it's particularly important across all types of healthcare teaching. Escape room concept does seem to be able to be applied to teaching and learning around some aspects of palliative care. And that escape room that I've just shown you now, we're rolling out for more wider use with smaller groups to build up the learner evaluation data and the facilitator feedback from using this approach to teach a difficult and sensitive subject area. Thank you very much for listening, and my email address is there if you wanted to get in touch.